How can parents of cystic fibrosis patients manage them better at home?
I'll be discussing about how to manage at home and what is the responsibility of parents. But as I said, sweat chloride remains the gold standard for making a diagnosis of cystic fibrosis in India, but it is not available freely in most of the centers or in most of the hospitals. So in that situation, research carried out at AIMS have made a simple algorithm using clinical symptoms and basic laboratory tests which may be available to most of the physicians. And that include that if a child is having recurrent or persistent pneumonia with bulky fatty stool or not growing well, if two of these things are there, then we take a history that whether there is a history of sibling death due to respiratory illness or his sputum culture at any time was positive for Pseudomonas. If it is there, then we are reasonably sure that we are dealing with cystic fibrosis, and we start the treatment and subsequently do a sweat test for confirmation of the diagnosis. If these things are not there, in that situation, we do as I described, aquagenic wrinkling. We put the child's hand in a water for 3 minutes and see if there is a wrinkling. We do a blood gas in which there is a low sodium metabolic alkalosis. We do a stool test for fat globules. All these three things, which are simple blood test and stool examination and aquagenic wrinkling, if two of these are positive, then we say that the child is suffering from cystic fibrosis and we can start the treatment. So
Okay.
now we discuss about this what is the responsibility of the parents and what is the treatment for cystic fibrosis. So as of now, there is no cure for cystic fibrosis. However, you can say that with supportive care, there is an improved survival from 6 months in 1950s to 45 years in 1920s. And it is only supportive care. And what is that supportive care? That I'll discuss one by one. First and foremost is that there is a thick and sticky secretions in the airway, or phlegm is very thick and secret, and that is choking the airway. So airway clearance and how you can do it, that I'll discuss in detail. So one is that we keep the child well hydrated. Well hydrated means the doctor generally tell the family that they should give adequate amount of fluid, along with that salt, common salt, and another salt is potassium. Once the child is well hydrated, the secretions are relatively less thick and viscid. Second thing is, generally the doctors will explain or a physiotherapist will explain regarding how to keep the chest clear. So that is universal, that all children with cystic fibrosis will need chest physiotherapy morning and evening. And there are multiple ways of doing a chest physiotherapy. One commonly called is a postural drainage and chest clapping, in which child is kept in different position and it is explained to the family, mother, father, as well as other caregivers, that how to perform this chest clapping in different posture after giving some medication, including some nebulizations. Then there, because this chest clapping and other thing may not work in older children, so there are other ways that the physiotherapist explain, which include active cycle of breathing, positive expiratory pressures, flutter therapy, autogenic drainage, and high frequency chest wall oscillation. And as I said, chest physiotherapy is mainstay of treatment of keeping the airways clean and to reduce the damage to the lung. So in that case, doctor generally explains that what all medications may help in improving the airway clearance. And in India, generally we use hypertonic saline, that is 3% or 7% saline after giving salbutamol to prevent any bronchoconstriction. So what happens is that a mother or father or caregiver gives this hypertonic saline after giving salbutamol and then does the chest physiotherapy as explained by the physiotherapist. There is another medicine that is called palmozyme that is not available and very expensive in India. So the first and foremost is that keep the airways clean by good hydration, salt supplementation, and potassium supplementation. Do a good chest physiotherapy, whatever has been explained by the physiotherapist or a treating doctor. That is important. Morning, evening, it has to be done. And there is no replacement by any medication or any injection or other medication. The other thing is that the parents should be able to identify that my child is worsening. That is indicated by increased cough, change in the nature of cough, increased phlegm or expectoration. There is a rapid respiration or some breathing difficulty. Child may stop eating as he was eating voraciously before this exacerbation. Then there may be child becomes lethargic. So if any of these things are there, in those situations, the parent should bring the child immediately to the treating physician. And then the treating physician will examine and decide whether the child needs just increase in the physiotherapy session or needs a antimicrobial or antibiotics. And antibiotics are given by inhalation route or by injections or oral. So as you can see, even for the respiratory management, there is a chest physiotherapy along with that nebulization, and then administration of various medications, identification of early exacerbation, as well as uh, giving plenty of liquids. So this is very demanding, and the mother has to do this thing full time in the beginning. Subsequently, children, once they grow up after 15, 16 years, they can take care of themselves. In addition, there is a regular medication. At least there may be 10 points in the prescription. So apart from this respiratory passage clearance and antibiotic, there may be doctor may prescribe about some treatment in form of a replacement of a pancreatic enzyme, fat soluble vitamin supplementation, and supplementation of the salt. Then there are some specific treatment for liver. If there is some problem for of a liver disease, then a medication is given regularly. So it is a full-time work for the parents to adhere to the treatment that would improve the outcome of the children with cystic fibrosis. Over. Till few years ago, uh, it was being considered to be lethal disease, or it will limit the lifespan of the child. And with proper care, though it is expensive, I'll tell you about what would be the expenses for per child per month. So with the proper supportive care, then they grow well. There are less pulmonary exacerbations requiring antibiotic and hospitalization. There is an improved nutrition, like they grow like any other child. And there is a preservation of the lung function. And there is a less depression. So, say 7 decades ago, the median survival for children with cystic fibrosis was 6 months, even in European countries and US. Now they are expecting that it may be around 4.5 to 5 decades, means 45 to 50 years of age. But we have to explain it very clearly that this is a median, or you can say in a common language that it is a average. It means half of them may have some problem before say 45 years of age, half of them may survive till 75 to 80 years of age. And with a good clinical care, by using all supportive care, we expect that the children should be surviving. Now this is about survival of children with cystic fibrosis in Europe and say Americas, and in countries where these medications are being supplied from the government or it is supported by the government. Even in our country, there is a good survival. At our center, we started uh, diagnosis of cystic fibrosis in 1993-94, and till now might have diagnosed around 900 children. And as of now, there are more than 20 years of age in 20% of the patients. Say if we are having we are seeing, say, around 3 to 400 children now, then almost 20% of them are more than 20 years of age.
Wonderful.
So this is about the prognosis. Say our group is working for this thing to how to make a diagnosis early, even in the resource constrained countries for last 2 to 3 decades. And now, say 4 or 5 years ago, we published this thing, and now it is part of say most of the textbooks, as well as people who are working in countries like India and similar setting, they are using it.